And then, so with her, after multiple failed courses of conservative therapies, PT, massage, chiropractic, trigger point injections, nerve block injections, medications, vestibular therapy, and that's one I kind of want to delve on and tie it back into even what was mentioned earlier was the eye movement therapy. When you have craniocervical instability, generally the body's gonna involuntarily try to govern that through the craniocervical musculature. And so the obliquus capitis inferior, obliquus capitis superior, rectus capitis posterior, minor, and major, all those muscles are linked through myodural bridges to the actual dura. There is something called a cervical-ocular reflex, which you have all probably heard of. And so with eye therapies or eye movement therapies, when a person already has highly overworked craniocervical or suboccipital musculature, such as the obliquus capitis inferior, and then you toss some eye movement therapy or any kind of vestibular therapy that involves the eyes and not so much the head and the neck, you do have engagement of those suboccipital muscles because they believe that the head is going to follow the eye movement. And so you're going to possibly overwork already overworked suboccipital musculature. And I've seen it happen with vestibular therapy and then with eye therapy. Acupuncture, elimination diet, psychology, exercise therapy, and ENT triage was done as well. And then none of that provided any relevant information. And she discovered that motion x-ray existed. And so she referred herself. So she had the sense that her neck wasn't feeling stable on her, or her head wasn't feeling stable on her neck. And she wanted it investigated. And thankfully, in our profession, people can refer themselves to us. They don't need a medical doctor to decide for them whether something is relevant or not, because of unfortunately, the limited knowledge and or interest that medical doctors have in anything that's not mainstream.